over the years, we've done many things that have expanded the scope of our specialty. We were really probably the first major teaching event to feature endovascular aspects of vascular surgery. And along with that, we were also the first to, or one of the first certainly, to involve other specialists that may have skills that supplement those of a vascular surgeon. And in addition, we really have tried, at least in the last 10 or 12 years, to cover everything that's important to a vascular surgeon or vascular specialist. That includes a very high intensity coverage of medical treatments, of course, all the open surgical treatments, looking at natural history, controversies, and of course, endovascular treatments and new developments, really cutting edge aspects of all these various aspects that are important to a vascular surgeon or any vascular specialist. Enrico, do you want to weigh in on that?
Yes. Yeah, I agree with everything you say for sure. One thing that the VEITHsymposium always have done over the years is to go and scout new techniques and new surgeons that are doing some innovative procedures, invite them. And many of these people that have contributed significantly to our specialty, the VEITHsymposium was the first platform where they introduced it. And some of them had sent their papers to the major journals. They were not accepted because either they're unknown or because they have a small series or just beginning. Yet the VEITHsymposium always gave them an opportunity to introduce that idea, this new concept, this new technique that actually became, and many of those became standard in our practice today. So that's one thing that differentiated always the VEITHsymposium, is because we're looking all over the world for new innovations and for people that are willing to share with us their contributions. The other thing that we always have done is not only to attract these younger, innovative surgeons, but also to discuss politics and to discuss the future of our specialty. The VEITHsymposium always had a discussion about the future and how best to face the challenges that our specialty, vascular surgery, faces it. Now we have expanded to include cardiologists and interventional radiologists in a big time. And in some areas, we do the same kind of procedures. So I think the VEITHsymposium was the first symposium ever to bring together multiple specialties that are dealing with the same disease and performing sometimes the same procedures.
Yeah, just to expand a little bit on that, the other thing that I think makes us different from all other society meetings and symposium around the world is, even though we're America-based, about 30 to 40% of our faculty comes from outside US. So we've really been very encouraging of other countries' advances. And, you know, every country thinks that they're the best and that they're the leader. But it turns out that in vascular surgery and vascular disease management, which really is the focus of our meeting, many other countries contribute even more than the US. We're restricted in part by a very active FDA, whereas in other countries, new things can be tried out sooner than in our country. And we've really focused on getting the experts who are involved in new technologies outside the US into our meeting. And really, they come from all over the world, from Asia, from South America, a large contingent from Europe. And that has made our meeting different. In recent years, particularly with COVID, travel has become somewhat restrictive. So that's a little more difficult to feature the way we have in the past. And to some extent, we've asked some of these foreign leaders, or out of US, I prefer to say, leaders can present PowerPoint presentations with synchronized audio and video. So it's as if they were in the room talking. Well, we've always felt that we have a excellent relationship with our societies, both national and regional in the United States. And indeed, the leaders of all these societies often congregate at our meeting. They have their off-season executive meetings at our meeting. They're all faculty members on that is, the leaders of these societies are all faculty members of our meeting. We're a little different than a society because we have more wider ability to include things that might not be included at a society meeting. And in addition, the beauty of our meeting is we put on what we think we and other vascular surgeons and specialists want to hear. It's not a competitive, abstract submission kind of format as the societies have. We basically ask people to come on the basis of what we know that they're doing that might be premature to present at a society meeting or not get on the program of a society meeting. So we cover the waterfront in a much more broad manner than a society can. And also the interaction between American society members and their out of US colleagues is something that is really a major opportunity at our meeting, which might not occur at a society meeting.
I think that there's no other symposium in the world that really welcomes those very large international and national vascular societies. For example, this year, we are going to host the World Federation of Vascular Societies meeting. They're very excited about participating in the meeting, and they have a space where they will introduce their own speakers and within the VEITHsymposium. So we always reached out to these societies, and the Asian Vascular Society, the Brazilian, those are some examples. And if you look at our site, there are logos of some of these societies being introduced every year in our brochures and our website. So our relationship with those societies is very, very close. We do a lot of interactive sessions. For example, we've been invited to participate in the Italian National Vascular Society, to have a session there, and many others, the Hungarian and many other societies actually are involved with us directly in exchanging sessions where we present, when we run some sessions, particularly the Chinese actually. We have several sessions in December. In this month, we have 2 major sessions in their major meetings. They're run by their societies. So I think that our interaction is great, and that allows us to also find out who is doing what and what's interesting and what's exciting, so we can invite these people to come to the symposium and present. So it's crucial now in this time that we interact with the national and the international societies in a very close way. Thank you.
Yeah, the other point, societies have many functions. One being that they need to represent in a political or general fashion a specialty. We don't need to do that. Our purpose is similar in some ways to that in a society, but which is only one of the missions of a society, but it's our total mission, and that is educational. Our purpose is to provide the best, most up-to-date, unbiased information that a vascular specialist wants or needs to know. And we can do that as our sole purpose, whereas a society has to fulfill many functions, representing the specialty politically and so forth. And so we have a unitary purpose which a society can't have.
Absolutely. The other thing that, just to show you how close we are from the society, Dr. Veith have received all the major awards that are bestowed upon a vascular surgeon worldwide. And the last one, they created a yearly lectureship under his name to increase the visibility and the importance of peripheral arterial disease. So this lecture is going to be a very important lecture is under Dr. Veith's name. And I think that just shows you also how our interaction with the societies have resulted in a very symbiotic effect where they are taking, I wouldn't say taking advantage, but they are benefit somehow from all the work that Dr. Veith has done in limb salvage. And they are in their meeting, they're going to have this major lecture that I'm sure is going to be very successful. So I think we have done very well with the Society for Vascular Surgery, the Society for Clinical Vascular Surgery, and all the regional vascular societies. We have great relationships with them, and we feel that in many areas is a very symbiotic approach.
One of the things that he initiated was to begin an associate faculty program at our meeting in which younger, less well-recognized vascular surgeons and vascular specialists of all specialties can submit abstracts and present their work at our meeting. Everybody likes to go to a meeting for many reasons. Probably one of the most important is so that they get a chance to speak and contribute. And the associate faculty program at our meeting is a chance for younger vascular surgeons to demonstrate their work, their skills, and so forth. And it turns out we really, under Enrico's leadership, try to accept every reasonably good abstract. It's not a competitive thing. We just add to the meeting. And the abstracts are all published in a supplement of the JVS. So a young vascular surgeon can not only get his work recognized by presenting it to his colleagues, it can be published so that he can cite it as a literature contribution and advance his academic and generally career in that way. Enrico, I'm sure you're going to want to speak to that issue also.
I think you summarized it very well. It's an opportunity for the young generation to actually interact with the vascular surgeon colleagues, the more senior group. And because the moderators, we usually put a lot of moderators in those sessions because that's the best way for the younger generation to get to know these people and also to listen to their opinion about when they present a paper or they criticize. Very constructive criticisms are being done during those meetings. The most important thing is that it has been successful because the number of abstracts keeps going up every year. We have this year, if you count all the programs we do for the younger generations, over 300 or 350 abstracts are being sent. Most of them have been approved because we believe that if a young vascular surgeons put the time to do some work by the clinical research, basic research, and write the abstracts and go over it and send it in very nicely written piece of paper, we feel that this man or woman deserves a chance to present his work. And therefore, and many of these, although the abstract may not be so innovative or so exciting, when they present the paper, they bring something new to it, and it's amazing how that generates tremendous discussion afterwards. So I think for the younger generation, it's a perfect opportunity. I wish I had that when I was in the beginning of my career. There's nothing that gives more happiness to an established surgeon than seeing someone that he has mentored over the years or he had given opportunity to present somewhere, and that can be the platform for them to jump into the future in their career. So I think the VEITHsymposium is just the ideal place for younger generations to participate, to get to know each other, they meet new colleagues, and is a very, very social event as well as scientific event. And so I'm very happy to be part of this effort. Of course, there are many others participating in this, like Jackie Simpson, our managing director, who does a tremendous job with this. Without her help, I could not do any of these programs. And also she adds a lot in the construction of these ideas. She has a lot of good ideas as well. And of course, Dr. Veith is the primary source of all this inspiration to perform all these new programs, to introduce all these new programs.
Well, again, a lot of this, and I think Enrico is being very modest. A lot of the good ideas, the new ideas that we introduce, have come from him. And I think what our meeting has tried to do over the years is change to make use of newer technologies, electronic technologies, so that what we present at our meeting, which is usually very short talks with a lot of different speakers addressing a very similar topic, which eliminates bias. All this is recorded and kept in what we call a virtual library, or a virtual textbook of what's new and important. And that library is available, it's well indexed and so forth, is available to all vascular specialists. And rather surprisingly, it hasn't been utilized to the extent that we feel that it should be, because maybe people don't know about it or we haven't marketed it well enough. But it's a tremendous resource that can help educate in an unbiased and fair way. Everything that's new can be presented to all vascular specialists around the world. So we think that that's a untapped resource, which we have to do a better job of marketing and making available to people who can't come to our meeting. Because if 4,000 or 5,000 people come, there are 25,000 or more very prestigious vascular specialists who can't come. And I think that the library or virtual text provides a way that these people can get the educational benefit afforded by our meeting. So I think that's something that we have to work on, but it is one of our innovations that everything that's presented at our meeting, almost everything, is recorded and is available to people who don't make it to the meeting.